is. Faith is not a blind belief. It is the strength found in our shared community and the convictions that shape our nation.
Welcome to Faith in America, exploring political and patriotic themes for a stronger nation.
All right, we're going to try this again. We tried it yesterday. We had some problems with the sound. Today I'm hoping we got that worked out so you can at least hear me when I'm talking to you. Let's first go to this screenshot here. I'll make that a little bit bigger for you so you can see it. Basically, Democrats are starting to. This here's Michael Rosa. He decided he would endorse Republican over Democrat Abdul Al-Sayed. Abdul Al-Sayed has the DSA, Democratic Social America agenda, which calls for defunding the police, doing away with the presidency, doing away with the Senate, doing away with the Supreme Court, of course, health care for all, and all the other freebies they want to get. And this far left, democratic socialist, almost communist agenda is not, it's splitting the Democratic Party. And a lot of more moderate Democrats are saying, no, I'm on the way out. I'm on the way out. And Republicans aren't faring much better. We have some Republicans that hate Trump so much, and they get so aggravated with everything he does, that they're willing to call themselves conservatives and tear down and tear apart the Republican Party. And this is definitely not what we want to do. But let me talk to you mostly today about universal health care. And the problem with wanting universal health care is, first, we have to clean up the universal health care we have. And the universal health care we have is the Veterans Administration and Medicare and Medicaid. So we're going to look at that today. And we're going to find out how much money is being lost through fraud, waste, improper payments, and government failure in these healthcare programs. And these are big programs. Department of Veterans Affairs, healthcare system, Medicare, and Medicaid. These programs exist for legitimate reasons. And veterans earn their benefits through service and sacrifice. Medicare provides healthcare coverage primarily for older Americans and certain people with disabilities. And Medicaid provides health care systems to millions of low-income Americans. These aren't abstract government programs. There's people's lives. And that's why waste and fraud should concern all of us. We also need to be intellectually honest. There's an important difference between fraud and improper payment. An improper payment doesn't automatically mean somebody committed a crime. It can involve an overpayment, underpayment, missing documentation, administrative mistake, or payment that doesn't meet program requirements. But here's the problem. Every fraudulent payment is an improper payment. But not every improper payment is fraud. And when billions of dollars are flowing through systems with inadequate controls, every taxpayer has a reason to demand accountability. And I'm just going to tell you, the numbers are huge. Let's start with Medicare and Medicaid. According to the Centers for Medicare and Medicaid Services in fiscal year 2025, Medicare fee-for-service had an estimated $28.83 billion in improper payments. That's a 6.55% improper payment rate. Medicare Advantage had approximately $23.67 million in improper payments. Medicare Part D had another $4.23 billion, and Medicaid had an estimate $37.39 billion in improper payments. That's approximately $94 billion in estimated improper payments across these four programs in one fiscal year. That's $94 billion. It's not $94 billion of proven criminal fraud. There's $94 billion that went out that shouldn't have. And so I want to look at this. Medicare and Medicaid are at risk. The veteran system is terrible. A lot of veterans don't even use it. But we need to get rid of the fraud, waste, and abuse. Doctors are being charged, pharmacists, nurse practitioners, and other licensed medical professionals. These people know better. And it's not criminals hiding in the alley. It's Medicaid money is not just federal money. The state put in on that, and other people do. And so, we can't have universal health care unless we get rid of the fraud, waste, and abuse. In fiscal year 2025, state Medicaid fraud control units reported 1,185 convictions, 856 fraud convictions, 329 convictions involving patient abuse or neglect, nearly $2 billion in criminal and civil recoveries, and approximately $4.64 recovered for every dollar spent on the program. They find the fraud, prosecuting people, they're recovering money, that's good. But we still have problems with people getting medical care they need and medical care that they want. Of course, VA has community care, which is about 2.4% of the program outlays, and that's for when a veteran has to go to a regular hospital or a regular doctor. And the own government watchdog says that particular program is vulnerable to fraud because it lacks a comprehensive fraud risk assessment. And while there is a lot of failure in the VA system and in the Medicaid and Medicare system, all failure is not fraud. It's easy to say billions of improper payments means billions of dollars were stolen. That's not accurate. We need to tell the whole truth. We need to tell the story, not a story. Some of the improper payments were wrong documentation, administrative requirements were followed, claims were paid incorrectly, information wasn't sufficient to establish eligibility, and providers received payments that didn't meet program requirements. Some of that's fraud, some of that's don't. But we need to look at this from a biblical perspective. What does the Bible say? Let's bring this back to the purpose of faith in America. The Bible doesn't tell us whether Medicare should exist. It doesn't give us a Medicaid reimbursement formula. It doesn't tell us how the VA should administer community care. But the Bible has a tremendous amount to say about stewardship, honesty, justice, and responsibility. Proverbs 11:1 says, "A false balance is an abomination to the Lord, but a just weight is his delight." That's about honesty. Luke 6:10 says, "He that is faithful in that which is least is faithful also much." That's about stewardship. And Romans 13 teaches that government has a responsibility to maintain order and punish wrongdoing. But when someone steals from Medicare, Medicaid, or the VA, they aren't simply stealing from the government. They're stealing money entrusted to the government by the taxpayers. And when someone commits healthcare fraud against Medicare, they may be stealing from the very seniors that program was created to serve. When someone defrauds Medicaid, they may be taking resources away from vulnerable people who genuinely need assistance. And when someone cheats the VA, They're taking advantage of a system designed to care for people who serve this nation, and that is morally wrong. But there's another side to the biblical equation. Biblical accountability doesn't mean we simply demand punishment. It also means we demand compassion. There are people who genuinely need Medicare. There are children and families who genuinely need Medicaid. There are veterans who desperately need quality health care. So the answer isn't eliminate everything. Better question is, how do we protect people who legitimately need these programs while aggressively protecting taxpayers from fraud and waste? This also applies as if we were to institute universal health care. How do we protect people who legitimately need these programs while aggressively protecting taxpayers from fraud and waste? And let's see here. Biblical accountability does not mean we simply demand punishment. It also means we demand compassion. Okay? We went to that. Government needs to connect information across programs. If someone is committing fraud in one state or healthcare program, investigators should be able to identify suspicious patterns elsewhere. 2, we should have real-time verification. Why wait for months or years to discover that a claim was fraudulent? Use technology to identify suspicious claims before the money leaves the Treasury. Number 3, stronger provider verification. Before taxpayers send millions of dollars to a provider, government should know, who are they? Are they licensed? Are they actually providing services? Are the patients real? Are the services medically necessary? And number 4, consequences. Fraud should have consequence. Not merely an audit, not merely a letter, not merely a repayment agreement. When somebody intentionally steals millions of taxpayer dollars, prosecution should be on the table. And here's one we don't talk about. Government employees and contractors. Fraud should have consequences. Okay? Come on down here. If a system repeatedly fails to detect obvious fraud, someone needs to ask, who designed the system? Who knew about the weakness? And who failed to fix it? How long did taxpayers continue losing money? Whose money is it? Maybe that's the most important question. Whose money are we talking about? It's taxpayer money. It's money of people who go to work every morning. It's the money of small businesses. It's the money of farmers. It's the money of factory workers. It's the money of retirees. It's the money of parents trying to raise their family. When that money is taken through fraud, wasted through incompetence, or lost because nobody properly manages the system, we all pay the price, the taxpayer. Government money isn't really government money. Government is the steward of money entrusted to it by the people. And Scripture tells us that stewards are expected to be faithful. 1 Corinthians 4:2 says, moreover, it is required in stewards that a man be found faithful. That's the standard. Faithful with the money. Faithful with responsibility. Faithful with the people. Faithful with veterans. Faithful with the elderly. Faithful with the poor. And faithful with the truth. So here's the bottom line. We don't want to exaggerate the numbers, nor do we want to minimize the problem. Okay? Government is doing well uncovering fraud, waste, and abuse. The answer is not more government. It's not necessarily less government. The answer is better government. Government that protects the vulnerable. Government that honors veterans. Government that protects taxpayers. Government that catches criminals. Government that eliminates waste. Government that learns from its mistakes. And government that remembers that the money it spends belongs to the people it serves. Because in the end, this isn't just about dollars cents, it's about stewardship. It's about honesty. It's about justice. It's about whether those who trust with responsibility are willing to be found faithful. I'm Paul Sharp, and this is Faith in America. Look, if we want universal health care, we've got to get rid of the fraud, waste, and abuse that's already in the system. Make sure the system is working efficiently and effectively. And when we do this, we may find we have the money to provide health care for those that need it. That's it for today. I hope everything works out okay. We will see you tomorrow at 3 o'clock and or 2 o'clock, however things go tomorrow. I've got some things I got to do, and but by 2 o'clock, 3 o'clock, we're gonna check things out and make things better. We're gonna keep working on it Monday through Friday.
Faith is not a blind belief. It is the strength found in our shared community and the convictions that shape our nation.
Welcome to Faith in America, exploring political and patriotic themes for a stronger nation.